The Department of Children and Families kicked off a statewide campaign for safe sleep due to several reasons. Just some statistics since this calendar year, January 2013 to present, there have been 143 calls to our child abuse hotline for deaths alleged to have occurred due to co-sleeping or asphyxiation. So a large number of children alleged to have died as a result of poor sleeping practices. It's heartbreaking when any child dies, and this is preventable. So the department felt like better community education, better practices by parents, we can bring that number down. Well, the reason calls come to the child abuse hotline are several. We unfortunately have found in a number of cases parents who have been under the influence of drugs or alcohol who have taken the baby to bed with them, and they have passed out and rolled over on a baby unbeknownst to them because of the condition that they're in, and suffocated the baby. And that's the reason why cases are called to us at the hotline, to investigate in every case whether some kind of influence was factored in, like drugs or alcohol, or was it some other kind of situation. But we need to look into these circumstances to find out what happened, and we can use that information then to better educate people on safe practices. The campaign is based on a couple of things: educating the public, and also using local resources like our local fire rescue personnel, first responders. They go into homes often, and when they get into those homes and they see that there's a family with a small baby there, that's a perfect opportunity for them to start some conversation with that family about proper sleeping, to ensure that there is a crib, that the crib is properly put together, and that the child, and that there is nothing in the crib that the child could asphyxiate, like a pillow or multiple blankets or stuffed toys, anything like that. We want nothing in the crib. So we want the babies to be alone on their back in the crib, ABC, alone on their back in the crib, nothing else in the crib that they would be able to get their little noses under and suffocate. We're aware that we live in a multicultural, very rich, diverse community here in South Florida, and all of the educational materials are available in English, Spanish, and Creole. There's lots of posters that are available that are going out to agencies and organizations that are working with children and families, medical providers, pediatricians, hospitals, birthing centers, all of those kind of places where we know there are young families with babies, as well as to the fire rescue folks, so that they can give that information when they go into homes. So in addition to the 143 cases that were called to the hotline this year, suspected of death by asphyxiation due to co-sleeping, we also, the department commissioned a study by the Annie Casey Foundation recently, and they found that of cases where the department had been involved with a family previously to investigate abuse or neglect, that when there was a subsequent death in those families, the number one cause was due to co-sleeping and asphyxiation. So another reason why we really feel it's important to educate both, the general public at large with new babies, as well as those families that are served by the Department of Children and Families, because this is entirely preventable. And education is, our best weapon, if you will, to inform people so that they can utilize those safe practices and keep these sweet little babies in safe conditions. The other component of the statewide Safe Sleep campaign is crib donation. Anyone can donate a brand new pack and play crib to any of the fire rescue stations in Fort Lauderdale and to the Broward Sheriff's Office station at 2601 West Broward Boulevard. So we would love to accept those cribs. We do have families who sometimes do not have the means to have a safe sleeping environment for their child and very much appreciate donations of those cribs.
I'm so glad the state is getting involved in this way. Michelle, I want to come back to you. What's the most surprising things that you've found over the last couple of years?
Yes, a couple of the things that are really concerning and consistent are that this last year we've had 86% of our babies that died in the last year were found on their stomachs. And of those babies, 43% of them actually had a crib in the home. You have another 57% that were co-sleeping with the parent in the bed. So we're seeing that these are really the consistent issues that are of great concern. I think one of the things that it has made Healthy Mothers, Healthy Babies look at is, while we have a Cribs for Kids program, and I definitely think that it is a need and it's something that needs to continue, it has helped me see that we need to examine the way in which that education is being delivered in the home. So we've begun to actually look at developing a kit or a flip chart, something to where families, providers can take it into the home and actually do specific, consistent education, talking through some of the language that we don't want to say, that your baby's going to suffocate, you're going to kill your baby. I mean, we have to have that language.
Maybe some of it has to do with who's delivering the message.
Exactly.
So, Jim, I think the fire rescue department has a level of authority that perhaps a social worker doesn't have.
Well, I've always, all the work that Michelle does and you all do is amazing work, but I agree, like fire department personnel, we have access to places that you guys just don't have access to. And once we get there, we're called there because somebody needs help. So we do have a little bit of a leg in on that. I mean, we are medical professionals to a lot of people that call us. And when we show up and we say, listen, this is bad for your baby, we do have a little bit more oomph behind what we're saying. And I do believe that creates change in a little bit more consistent way. And again, about, I do want to share one story. We did have a great success story, and we've had a lot of them, but one really stands out talking about access is we had Engine 2 and Rescue 2 actually go to a home late at night, and these are busy trucks. And when they walked in, there was an EMS call, there was a medical call there, and the rescue guys and the engine guys went in and started taking care of it. And the lieutenant who was on the call, Lieutenant Kim Wells, she's an excellent lieutenant. She has been trained in the program, and she noticed that there was a woman holding a small child in the back of the room. So she made access to her and talked to her and said, how old's the baby? And we found out the baby was less than 1 year of age. And so she said, we're with the fire department and we're doing this program. And so one thing led to another, and she asked if she could see where the baby sleeps, and there was no crib. So Lieutenant Wells was like, well, listen, we need to get your crib. It's important. And she said, no, wait, I have a crib. It's in the closet. I have no idea how to put it together. And so that moment was amazing in my eyes, because that would have gone unnoticed and unseen. Anyone else would have just bypassed that. So the guys left with the rescue guys, took the patient and left, and the engine guys stayed there till very late at night putting this crib together for this mom. And then, of course, they gave the education, made sure the baby was on their back, it was free and clear for any obstructions, and that baby is sleeping safe right now because we were able to recognize that. And I think that's the great thing that fire rescue adds to the equation,
That is an amazing story and a great way to end. And I hope that message translates to the other fire rescue departments. Because again, sometimes it may be about who's delivering the message as well. I want to thank Michelle Reese and Jim Carroll for all they're doing to educate parents about preventable death due to unsafe sleep practices, and Kim Gorsuch for describing statewide efforts on this issue. Please remember to put your baby to sleep on their back with no obstructions in the crib. I've been your host, Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County, where our mission is to empower Broward's children to become responsible, productive adults, capable of realizing their full potential, their hopes, and their dreams. Stay tuned immediately after this episode for a video, part of a training package for fire rescue personnel that Healthy Mothers, Healthy Babies has developed. For copies of this program or any other episode of Future First, please call the Children's Services Council at 954-377-1000 or visit www.cscbroward.org. Like us on Facebook, and remember to join us next time on Future First, Focus on Broward's Children.
Unequivocally, I think that pediatric calls are the most difficult calls we run. Number one being that we run those less than 5% of our career in the total number of calls we have. So you have something that we hardly ever run, but you have to be on the top of your training when it comes to that. I think that every call is a pediatric call. You may not even necessarily be there for a child, but if you see a newborn, a young child, that you should inquire about them and you should say, hey, what's the crib look like? Do you have a crib? I've been amazed at how many calls we've run where you've asked somebody, do you have a crib? And they say no. So it is something that you should be aware of and something that we're there to prevent. It's our job. If we can prevent one of those children from being killed by cluttered crib or being smothered by their parents, that's one less call that we have to run in that manner. I believe that training is unequivocally the most important thing that we can fall back on. If we know and we train and we do it over and over again, it becomes a muscle memory and it becomes something that we do second nature without thinking.
Last year, there were too many infant sleep-related deaths in Broward County. All these deaths could have been prevented if parents and caregivers were better educated on what not to do when putting their infants to sleep. You can help prevent an infant's death just with a small change in your behavior. The first thing to keep in mind is that every call is an infant-related call. Whether your rescue company responds to a kitchen fire or a heart attack emergency, taking inventory of your surroundings will reveal evidence of the presence of an infant in that particular home. Learn to look for the small signs: a crib, baby formula, diapers, bottles, or even toys. Also, pregnant women are good targets to communicate information about infant safety. Another very important point to keep in mind is that grandparents, aunts, and other family members might not have baby items in plain sight, but this doesn't mean that infants don't occasionally sleep in their home. In these cases, it is harder to spot the signs of infant presence, so it is important to always keep looking for signs. Of course, your first priority is always to take care of the main reason you were called in the first place. After the patient is stabilized, a designated member of the crew should engage someone on the scene and ask if there is a baby present in the home. If a family member reveals an infant 1 year of age or younger, a safe baby sleep kit should be given to the family, along with verbal education. If time permits, ask to see where the baby sleeps to perform a sleep environment check. If you see a crib cluttered with blankets, bumpers, and other items, remove these items and explain to the family why you are doing so.
You can never put your baby down on their belly. And all the stuffed animals and blankets and pillows, this stuff suffocates kids, okay? So look, we're gonna have to take this stuff out.
Sometimes financial constraints don't allow a family to purchase a crib. In these cases, the mother sleeps with their infant. This is a perfect opportunity to explain the reasons why this is dangerous. This is also the perfect opportunity to have a crib delivered to the home, provide instructions on how to assemble it, and make sure that every family member knows the do's and don'ts when putting the infant to sleep. Education of the entire family is crucial in preventing infant sleep-related death. You are the first line of defense. Remember, every call is an infant-related call.
For information on obtaining a crib and other resources for a family in need, please contact Healthy Mothers, Healthy Babies Coalition of Broward County at 954-765-0550 or visit hmhbbroward.org. Production of this video was funded by the Children's Service Council of Broward County, Florida. Our focus is our children.